Hello and welcome everyone to today's panel discussion brought to you by Athletes for Hope and Athlete Edge at EDCare. My name is Nicole Rains and I am deeply honored to serve as the moderator for today's conversation. So as many of you are aware, this week is Eating Disorders Awareness Week, providing us with a valuable opportunity to shed light on the topic of eating disorders within the realm of athletics. Specifically, our discussion will coincide with the theme for this week, which is unifying through community and connection. We are fortunate to have a panel of esteemed experts who bring a wealth of professional expertise, personal insights, and lived experience to the table. Before we begin, I would like to invite each of our esteemed panelists to introduce themselves and share a bit about their background and connection to this important topic. To kick it off, I will pass it off to Kate Daley.
Hi everyone, thanks for having me. I'm Kate. I am an eating disorder and sport therapist and dietitian, and at Athlete Edge, I'm the primary therapist. And yeah, that's pretty much about me.
I'm Taylor. I'm the mental performance coach here at the Athlete Edge program at EDCare. About 6 years working in the eating disorder community at all different levels. So it's definitely been an eye-opening experience and a lot to share.
I'm Alice Merryweather. I'm a retired alpine ski racer, 2018 Olympian, and I'm also an alum of Athlete Edge at EDCare. Thankful for all of their help, as well as a Athletes for Hope whole being athlete ambassador, which is sort of an intersection of education and advocacy through the Athletes for Hope organization.
Hi, I'm Taylor Miller. I am a current Division II women's basketball coach. I'm also a former women's basketball player at Division III. And I have personal experience with having an eating disorder and received treatment through Eating Resource Center and have been an Athletes for Hope and Hope Being ambassador for a few years now, just sharing my story through storytelling. And I have a really personal connection with this, as well as just a strong advocacy for it.
Awesome. Well, thank you all for introducing yourselves and being here today. Let's get into our discussion. So eating disorders thrive in isolation, yet recovery happens in connection. How can athletes, coaches, teammates, and families help break the silence and foster a culture of openness and support in sports communities?
I
can take this one or start with it. One of the most powerful tools for me when I was recovering from my eating disorder was leaning on the people around me, and that meant I had to be brave and speak up when I needed help or when I wasn't feeling okay to talk about something or needed support with a meal, something like that. But it also meant that the people around me had to be very engaged, and I'm really thankful that my whole support community was up for that task. They asked a lot of questions. They were very curious about what I was going through, and they weren't afraid of asking what I needed or what I was ready for, capable of, how I felt mentally on any given day. And I think that curiosity from the community around me was really, really important to my own recovery.
Absolutely. That's awesome. I think from a clinician standpoint, something that's really an important part of all of my patients' treatment plans is building that community. So especially when maybe they don't have the support that maybe Alice is speaking to, helping them foster that, because eating disorders thrive in isolation. And I think the other piece as well is really getting family, which can look like sport family, friends, etc., involved in the treatment. So that athletes don't feel as alone. And oftentimes that looks like bringing in coaches, teammates, etc., helping them communicate their needs to those people that they spend so much time around.
Yeah. I think to build off Alice and Kate, like in addition to like just having like the connection with sport around one person, like it takes that first step. And I think that first step to sharing with whether it's friends, family, teammates, coaches is like a lot of vulnerability. Like athletes are putting themselves in a vulnerable space like every single day when they're training, when they're competing. And this is just like something that I think is oftentimes not considered. So like it seems like this very giant barrier to then actually attack and just be vulnerable with. And I think it's what putting themselves out there and talking about it is going to be that first step before you can even begin to connect with those support groups that one hopefully has.
Yeah, I agree with all of that. I also think, just in my personal experience with my eating disorder, I was very isolated, and I lived in a city where I knew no one, with no family, no friends. So I definitely thrived in isolation. So I know how that can be. And I know how eating disorders can thrive through that. So as a coach and a former athlete, I definitely prioritize making sure that my athletes know that um, they're cared for, and they have an open door policy with me, and they can feel comfortable about talking with anyone and fostering that culture, just inside and outside of the basketball court. I just think it's really important for them to know that I'm always here to talk about anything, whether it be basketball or mental health and things like that. So I think it's really just important on just creating that culture in general, and just making sure that athletes don't feel like they're alone.
Totally. Thank you all for your answers. Next question that I have for you all is, many individuals struggling with eating disorders feel disconnected from their support system. So what strategies can therapists, coaches, and parents use to rebuild trust and create an environment where individuals feel safe seeking help?
Personally for me, I think it's eating disorders have always, in our society, in our culture, been kind of one of those topics where it's like a don't ask, don't tell sort of thing. So it's opened my eyes since being able to talk through my story, and talk with others through their stories, that it's okay to talk about, and it's something that is very prevalent within athletics, especially. And I think it's something that we shouldn't be, ashamed of or anything like that. So I think just opening that conversation and that topic in general, I think, as far as mental health goes, I think it's starting to be talked about a little bit more, just in my personal experience as a coach. I think we do a really good job of helping athletes be able to talk about that. But as far as eating disorders go, I think it's one of those topics that we have to make sure that we allow athletes to have that voice and have that opportunity to feel like they are able to talk about it and know if they're struggling, that it's something that it's okay to be not okay about.
Yeah, I think to like just build off what Taylor shared, is like coaches, I think in a lot of environments hold so much power. Like I know, like I was asking, like what can clinicians and parents do? And I think like we can only do so much, but when someone is part of this training group, this training organization, like it's the coaches and the other team leaders that are setting the culture, they're setting the example, the standard for the team, the group, the organization. And like unfortunately, I've had athletes come in say like there have been posters in their weight room that are the FYF poster, and it's like, great, that's a wonderful start. If you don't know what FYF is, go Google it. And so like it really can start from that leadership. Like if it's not there, like people are not necessarily going to feel safe. They're not going to feel like they can speak out. They're not going to feel like they can be vulnerable. And I think that's a big challenge when we're working with people who are getting ready to go back to sport, and they're like, I don't know if I can talk about it yet. And I think that's when the talk of like, are we transferring? Are we retiring? Are we just finding some other way to like be an active individual that's maybe not a competitive athlete? It's like the biggest challenge. And I think it sounds like with Taylor's own experience and what she spoke to, like educating. It's just like letting everyone like be open and know, like having coaches and leadership go do the extra legwork to educate themselves, so they don't always have to like learn on the fly when they might have an athlete who shows up day one of training camp. It's like, oh, this person may or may not have an eating disorder.
I think the other important thing too is really getting family involved from the start. And again, that doesn't have to be like parents or siblings, but what I find a lot in the work that I do is that there's a lot of like unknown, and it goes back to that education piece of like parents learned it from grandparents who learned it from their parents, right? And there's this generational piece with diet culture, and then how that infiltrates sport culture, and how sport in a lot of ways has come to accept the role of diet culture, and almost praised it in a lot of ways. And so I think the biggest thing we can do is help shift people's mindset to and like plant seeds to help them think differently about certain components of sport that they think are non-negotiables related to diet, related to bodies, etc. And so I find that a lot of work that I do is around like planting those seeds and kind of helping people, not just the patients, but and the athletes, but also their support system shift that mentality a bit.
I mean, I think you guys all nailed it. I would just say that through my own experience, having my parents work on educating themselves, because I mean, all three of us knew nothing about eating disorders until I had to go to treatment for one. And they were really open to learning alongside me. They attended family therapy sessions with me, and they asked questions and also learned about kind of diet culture, the things that they were maybe doing subconsciously that society has told them is okay, or things that are okay to say. And they got really engaged with that and worked on being really mindful about when they were using those kind of societal norms or actually being more informed and using the education that they had. And then on the coaching side, in this curious world, it's a lot of Austrian men that are the coaches. And so I think their eating disorder education seems especially poor over there. But my coaches were really patient with me, and they kind of treated my eating disorder as if it were an injury and gave it the patience, the respect that it needed and that I needed during that time. And I think that patience was a really helpful tool where like they could kind of step back and learn a little bit about what I was going through and not feel like they needed to be rushing me through something. It just gave us all a little bit more space to heal and get to a place where I could actually return to sport.
Yeah, absolutely. It's definitely important to have an army of support around you, especially in this case where, it can be a little tricky. So the next thing we want to talk about is the pressures of athletic performance that often contribute to disordered eating behaviors. So how can we shift the conversation in sports to prioritize well-being and mental health over aesthetics or weight-based performance standards?
I'll jump right back in with this one. So skiing is not an aesthetic sport. It's honestly, we call it a gravity sport sometimes because you're just going down a mountain. But you're also doing that in a very tight spandex suit. And it's still a very exposed and vulnerable feeling when you're out there performing. And so for me, I struggled a ton with body image and what did I look like when I had all my gear on and in my suit, and what if I didn't look like an athlete or compared myself to athletes of other sports. Like that comparison, even from my own non-aesthetic sport to athletes of all other sports, was really, really unhealthy for me. And I think that comparison oftentimes of like, what is the athletic ideal, not what is a body that's going to help you perform your best, that gets focused on a lot more. And I see it also, especially during the Olympics, but during any major sporting events where conversations from commentators, families around the TV often go to what an athlete looks like or what their body is, or comparing one athlete to another on the field of play. And I think that's so harmful, even if it's meant as like, wow, her legs are so much stronger than the girl next to hers. Even that can just kind of get those gears working in a young athlete's mind, or anyone who is vulnerable, really, and just think, well, what do my legs look like compared to those two people? And I think those conversations can be really harmful as it centers around kind of bodies in sport.
Yeah. I think this might be like a very cliche thing, but I think there's a lot more to it than people always like might give the time for. But it's the whole like age-old saying of like function over figure. Like, and it also comes down to like the mind and the body. Like for the body, of course, like, hey, it's like, is this like, especially if we're deep in our eating disorder, like we're probably maybe not feeling ourselves appropriately. Maybe there's overexercise, like we're not well rested. So we're like abusing our body, and our body's like not up to the task to then compete and be able to do what it needs to do for both practice and competition. And then like mind is going to be like the same way. If we're not treating our mind well, if we're going to have like a lot of negative self-talk or have a lot of ruminating negative thoughts and just don't treat ourselves well, like we don't practice self-compassion, then like, we're not going to perform well. Like gun's going to go off for the race, or like buzzer's going to go off, you know, like ball's going to be tipped, whatever the sport is. Like it's like, well, now what? And so it's like really training and educating oneself and practicing that self-compassion, self-care, and that you gotta just look at it as like, hey, like how is this serving me? Like I feel like it comes down to function over figure in so many different ways all the time. Again, cliche, but like very understated in a lot of ways.
Yeah, I think just going off of them, I think in my personal experience, my eating disorder really surfaced after my athletic career was over, after I graduated college. And so it was more for me of just not knowing who I was as an individual after sports were over, and kind of just navigating through that. And I just kind of fell deeply into just exercising and things like that, the things that like I knew that I could do and that I loved. And I'm still an avid runner, and I think that's something that, for me, I enjoy, and I think it's like a therapy for me. But it can, get to a point to where it becomes unhealthy for some people. So I think, that's where we have to find ourselves through different avenues, find ourselves through just who we are outside of just our sport and not defining ourselves by our sport. And I think, that's something that with my athletes, I really try to have that conversation with them before they even get close to ending their sport, just because I want them to know who they are once, the sport ends. Who are we going to be? What are we going to be? And not to define themselves as just a basketball player, as just an athlete. Because once that's over, I know personally, like you lose yourself, and you lose that identity, and you kind of start to fall away from, everything that you've ever known. So I think just for me, that pressure to perform and that pressure to, know how my athletic body is versus my body in general, after sports, things fluctuate and things are going to change. And, we have to have those conversations with our athletes.
Yeah, I think you all bring up some really good points, and something that came up from you and Taylor was talking, Taylor Smith, my colleague. I think something we see a lot is there's this piece of people have already, some of the athletes that we work with have already lost the race, the game, etc. before the gun went off, right, as he was kind of speaking to. And I think that often has to do nothing with how the body looks and everything about like the mentality. We also see this a lot when people return to sport. If weight gain was part of their treatment, feeling like, oh, if I'm not at the fitness level I was before, it must be because of the weight gain. Whereas it's like, oh, maybe it was because you took 4 months off sport, and looking at it as these other pieces. I think the eating disorder does a really great job of identifying changes in weight, changes in body composition as the culprits per se for why someone maybe is not performing at the level that they expect to be or that coaches want them to be. And I think it's really important to look at the holistic picture and think about there are like over 40 factors that influence sport performance, and like what are some of the other ways that we can focus on and really like lean into those other factors too, is something that I really try to help my athletes with.
Yeah. Yeah, just based on what everybody has said, eating disorders definitely do not discriminate based on age, gender, race, sport type, etc. So very important stuff that we are talking about here, and I appreciate it. So let's bring it back to connection. Connection plays a crucial role in long-term recovery, as we've kind of discussed earlier today. What are some practical ways communities, whether in sports, schools, or treatment settings, can continue to support individuals beyond their initial treatment or diagnosis?
Yeah, here at EDCare, like we have like our 5 pillars, and we call it CAMSA, and C is for connections. It's like a huge thing here. I think I echo it a lot in my groups and my sessions. And I think I'm kind of stealing this from Kate a little bit, because she coined this, I think, several months ago, of like the different phases. And like phase 3 is like the time where like they go back home to like go back to school, go back to their life, go back to their sport and everything. And we do our best to prepare for that. And like that connection piece is so crucial. And I think like, especially like with Kate and her family therapy work, and what we like, some of my groups, we talk about like the need for connection, having support circles and individuals to reach out to when they go back home. It's so like creating that plan. I kind of like, sometimes I have them like map it out, like who are people we can talk to, who can we begin like reaching out to. Sometimes we'll even have like, all right, you're closing in on discharge in a few weeks, let's sign some more ROIs and like start opening up about our like our story that we haven't, with people we haven't really connected with just yet. So like it's just bringing back in all those people we can, reaching out, being again that vulnerability piece, like, and hoping everyone kind of approaches with like a open mindset, and recognizing it's not a quick fix. Just because they're leaving treatment doesn't mean like, hey, we're good to go. Like there's going to be more barriers and more hurdles to get past.
Mm-hmm.
Yeah, I think for me, personally, I left treatment, and it was obviously scary, but I think being able to stay connected with some people that I had met through treatment, and some people that were really there for me during that time, family, friends. I think that's what really helped me continue to, thrive in my recovery, and continue each day and each moment to work towards, just trying to recover and be back to who I used to be before my eating disorder, and just really thriving through that connection and through, the things that I've learned through treatment. So I think those were really important for me.
I think something I think about is people, I'm going to steal this analogy from our program advisor, Nicole's. He talks about this balloon analogy, and I think a lot of our patients athletes come in with like one balloon, and it is their sport. And it's like, what happens when that balloon pops? There's nothing left to hold you up. And so I think a lot of the work we do is trying to help people be okay. They don't have to love if they end up having to retire from sport, or they end up not returning. Like they don't have to love that, or if they don't get back to the level that they thought they were going to, and maybe they do, right? But like we have to think about other scenarios too. And my goal and hope for them is like we can foster the like okayness just by no matter what happens, right? And to build them up by adding more and more balloons. So like if that pops or if it deflates a little, right, there are other things holding them up. And I think one of those things is that connection. And I think that also looks like having support outside of the team. I was a college athlete too, and oftentimes a lot of your friends and the people you interact with, because you're with them 20 hours plus a week, that's like your family, and that's who you connect with. And I think something we work on here is like, how can you also expand your support outside of that? Whether you go back to your team or not, some people don't want to go back to their sport too. And so like, how are we finding other hobbies to build connection, or other pieces to build connection, to have like tons and tons of balloons? And so I think that's like something that I think about a lot and keep kind of as a thread throughout treatment for the individuals that I work with.
I'd never heard the balloons, and I really like that. kind of building off of what Taylor's experience was in treatment and leaving treatment and relying on those people, I felt the same way about some of the friends that I made while I was at treatment. Like, we stayed in touch. We still stay in touch, and it's been 5 years. And especially in those first few weeks when you leave treatment and you go back to normal life, right? It's really scary. And I hadn't had really vulnerable conversations with a lot of people outside of treatment. And so to be able to pick up my phone and shoot a text to my group of friends from treatment and be able to just say honestly how I was feeling and kind of relate through what we'd learned at treatment, I think for all of us, that was such a valuable tool. And that helped me then kind of get more comfortable speaking about what was going on so that I could then take that vulnerability to other people in my life, which then fostered a lot more deep connections to the people around me as I got more comfortable back in the real world. But leaning on those treatment connections, especially in that early phase, was super important for helping me do that in the rest of my life.
Yeah. Well, those are all of our questions for today, but I just wanted to take a moment to just thank all of you for being here. I thought this panel was great after we got into it because we have two people who are former athletes and they have lived experience with this. And then we have a couple of our experts in the field to really touch on this as well, to bring it full circle. And I just really appreciate your time. And yeah, so I hope you all have a good rest of your day. Thank you.
you.
Okay.
Thank you.
Yep. Take
Thanks.
care. Bye.